And so Australians could be getting booster shots from the first quarter of next year, is my information, with Pfizer boosters likely to come before AstraZeneca because AstraZeneca is apparently longer lasting. This is being worked out by Commonwealth medical officials now, who are deciding whether or not you will need one booster shot next year or two. And it looks like the consideration is that to wait a year for your next shot might be too long. You might need your third shot within 6 to 9 months. We revealed yesterday that Pfizer doses are being spaced out in New South Wales to 8 weeks between doses, including in hotspot local government areas, away from the nationally recommended 4 to 6 weeks. This again points to a lack of supply, and despite announcements from the PM around bringing forward Pfizer, including today, New South Wales is still struggling to get enough amid their outbreak. New South Wales Premier Gladys Berejiklian was pressed on this 8-week gap by our reporter Danica DiGiorgio today.
Some residents have been told to wait 8 weeks between their first and second Pfizer dose. The national standard is between 3 and 6 weeks. How far will this push back your modelling to get to 70 and 80% vaccinated? And are those residents in those suburbs now at higher risk?
The best health advice we have received from Dr Chan and the public health team is that we need as many people as possible to get that first dose in their arms. Once they have the first dose, we know they have a level of protection. And that is why we followed the health advice, and Dr Chan and the public health team have been very clear about that. The timing between the doses is based on what is going to give maximum number of people maximum coverage in the shortest possible of time. We are still estimating that we will hit the 70% double dose figure somewhere in October.
And New South Wales Health Minister Brad Hazzard was more obtuse, saying there just wasn't enough Pfizer when questioned on why, when 16 to 39-year-olds had been told they were now eligible, they couldn't get an appointment in Sydney until October.
We keep hearing that there are vaccinations available at Kudos Bank Arena. I've just been sent a message, someone watching this at the moment, frustrated that they can't book a 16-year-old in. The website is showing no vaccination bookings available at Kudos Bank Arena for 16-year-olds until October.
I know it's a struggle because I've spoken to quite a few people who would like to have the vaccine. Quite simply, there is not enough Pfizer in New South Wales or anywhere in the two major states, that is New South Wales or Victoria, for the people who are now wanting it. We're certainly asking the federal government to try and get us more Pfizer vaccine.
So we saw Prime Minister Scott Morrison announcing 500,000 doses of Pfizer from Singapore early this afternoon.
And I'm pleased to announce today that we'll be boosting our September effort with a new dose swap deal with Singapore, which will see 500,000 doses arrive this week for distribution next week. It's a dose swap deal, which simply means we're taking the 500,000 they have now, so we can put that into our distribution this month coming in September, and we will provide them with 500,000 in December.
Well, that's 500,000. Have a look at this. The federal government is expecting 4.3 million doses of Pfizer in September, now up to 4.8 after today's announcement, 9 million in October, 9 million in November, 9 million in December, and 3 million Moderna in October, November and December. So here's the problem. Just as New South Wales is supposed to be opening up, and no doubt Victoria are, the Pfizer and Moderna will be flooding in. It's 2 to 3 months too late. And Scott Morrison got questioned on this in Question Time.
Is the Prime Minister aware that today the New South Wales Health Minister Brad Hazzard confirmed the gap between first and second doses of the Pfizer vaccine in Sydney will be spaced out to 8 weeks? Mr Hazzard said, simply, there is not enough Pfizer in New South Wales or Victoria for the people who are now wanting it. Why didn't the Prime Minister do his job on vaccines?
The Prime Minister has the
Mr
call.
Speaker, the decision to focus on first doses in New South Wales was a decision taken together between the Commonwealth Government and the New South Wales Government. And it was done so, Mr Speaker, because of the outbreak that was occurring in south-western Sydney, and to ensure that we maximise the use of vaccines in that part of the country, that part of Sydney, to ensure that we lifted the level of resilience.